everybody. Welcome back to the Pre-Med Pod. Today, we are with a special guest, Dr. Emily Barnard. Emily, do you want to tell us a little bit about yourself?
Yeah, hey. My name is Emily. I am currently a radiology resident at UC San Diego. I just got started in this program in July, so I am a baby radiologist and have about 5 more years left of my training before I'm an attending.
Have you always kind of been in the San Diego, SoCal area, or have you lived in different parts of the US or the state, or yeah?
Yeah, I guess a little bit more about my background. I am from Georgia, so I'm an East Coast girl. I grew up in around Athens, Georgia, which is about an hour and 30 minutes northeast of Atlanta. Um, I like grew up in a pretty rural community. I like joke with my friends out here that like we had cattle like at our high school for all of like the agriculture people and like had a little greenhouse. Like we were like really like out there. And it's actually I talk about how rural it is, but it's actually growing a lot. That area is. But I yeah did high school in that area. I went to college at the University of Georgia, which is in Athens, Georgia. So it was basically in my hometown. I majored in cellular biology, and so I was involved in some research and just really knew that I wanted to do medicine pretty early on, and so kind of decided to do like a science major, which is definitely not something that you have to do. So I know like I have told people before, like if you are interested in art or communications or business, definitely go for those because it's not required to apply for medical school. You just have to have the prerequisite science classes. But I kind of went like I like dove in and just went straight up science courses and like didn't really have like the fun courses where I got to like, explore different things, but definitely not what you have to do. And then for medical school, I went to Mercer University School of Medicine, which is also in Georgia. Their main campus is located kind of close to Atlanta, but I got to stay at a satellite campus in Savannah, Georgia, which is just by the coast for 4 years. So that was really lovely. I realized that I am definitely a beach person, and so wanted to be as by the beach as much as possible. I have family in San Diego, and so that was one of the main reasons why I wanted to be out here on the West Coast. But my husband and I had always dreamt about ending up in San Diego, and so I had an intern year. So for radiology, we have to do 1 year of a basically primary care type of year. So you can do a year that is a general surgery year. You can do 1 year that's all internal medicine, or you can do a year that's kind of a mix of a bunch of things. And so I did the one that's like a mix of things. So, which is called a transitional year. It gets a little confusing, but I did that year in Miami, Florida. So was able to stay kind of by the beach, which was also awesome. And that year was a lot of fun. I felt like I learned a lot about myself and just what it means to kind of be a doctor. I spent a lot of time in the ICU, so medical and trauma ICU. Had emergency medicine rotations, a lot of medicine rotations and surgery rotations. And then, yeah, and so now I am out here in San Diego and just got started. I am in my second month right now. I started off, my first rotation in radiology was nuclear medicine. I just got a good like introduction to that. And right now I'm currently on chest. And so it's, chest x-rays, CTs. It's kind of it's a fun rotation. It's a good mix. So it's a lot of emergency scans. So people coming into the ED, inpatient scans. So patients that are in the hospital, um, a lot of ICU patients that are intubated, just kind of making sure everything looks okay. And whenever a trauma comes in, we're responsible for looking at all the imaging, seeing if there's any fractures, any bleeds, pneumothoraces, that kind of thing.
That is so exciting because I'm right now, well, we're both seniors in high school, but I have an internship with a radiologist that I've been like it's been my internship since December. So I love looking at all the images and like doing my PET scans because I can like do a full PET scan and I love it. So when I saw your like radio interventional radiology thing, I was like, yes, we need this.
Yeah, that's super awesome. It's cool that you're getting exposure to it as young as you are. The radiologists that you're rotating with or shadowing with, what kind of radiologists are they?
um, I don't know. He does like the nuclear stuff, but he's not like exclusively nuclear.
Yeah, I think that's one of the cool things about the field is there's a lot of different opportunities and you can kind of make it what you want. So I know some people will do fellowship, some won't, and so just kind of depending on the practice that you're in, you have the flexibility to really hone in and focus on one specific thing, or you can kind of do a little bit of it all, which is really neat.
I'm in Florida. I'm like pretty close to Miami. I'm in South Florida, and I moved from Southern California. So we kind of like swapped.
Oh yeah, we did.
Um, but just to go back, all the way back, how are you in high school? Like, what was your high school experience like? Did you take any AP classes that were geared towards science, or like tell us a little bit about your high school experience?
Yeah, so in high school, I knew I wanted to be a doctor pretty early on. I will say my dad is a radiologist, so medicine was always an interest. I didn't really know radiology until a little bit later on in my path because I wanted to do something different, but here we are. Um, but in high school, I did take AP courses. I will be honest, that was a while ago, so I can't remember exactly which ones I took, but mostly like the sciences. I remember taking like AP Calc. That was not a fun class to take. Or like the history classes. I feel like I took some APs like world history. I feel like they've probably changed up the courses that you guys have from kind of what I did back then. But yeah, was always trying to take whatever science classes I could. I remember we had a human anatomy class that I took in, I think, my third year of high school, and I absolutely loved it. I think we had like an introduction to nursing that I also took. So pretty much anything that was offered that had any kind of medical relevance, I tried to take. So I was involved in like a few different clubs. I feel like that was like a good way to connect and kind of learn more about medicine. I think there was, and I'm forgetting the name of it now, but we had like a club where we would just kind of like have people present about different medical specialties and kind of learn more about the different opportunities that are out there. And in high school, I was a swimmer and a runner. And so I was on those high school teams and love cross country and track and still run a little bit today. I don't really swim much anymore, but maybe I'll get back into that.
What events did you do in track and cross country?
Yeah, so for cross country, it's basically just the 5K. And then for track, the 3200 was my favorite. Was usually in the 4 by 800. Sometimes when they felt like testing me out more, they would put me in the 4 by 4, and that was a little too quick of a race for me. So
I have a lot of respect for you for doing those races. They're definitely the painful ones in the group.
yeah, I like endurance stuff. I feel like I'm small. I'm 4'11". I'm like a tiny person, and so my legs just aren't as long as other people's. And so the longer the race and the more it's about endurance, the better I do.
That's hilarious. Did you notice at all that maybe running and track and I guess just like extracurriculars and other activities kind of help balance your work lifestyle in general?
In high school, I definitely liked being on those teams and having sports. I like just having goals, I guess, and like having goals outside of career goals. Like I think it's healthy to want to do like the next race and like hope that you PR and like train for it. I think it really helped shape I guess just my mentality towards achieving different goals and helping me with time management, with just being committed to something and putting in the work even when I didn't want to. And a lot of that did translate over into, undergrad and medical school, like studying, just like knowing how to time manage and knowing when I needed to take a break, but also just not really giving up when I wanted to, because there were a lot of times where I wanted to.
I guess you said like you still do a little bit of running today, but are there any other kind of activities or things that you do to help you, of course, balance throughout undergrad, med school, now being in your residency?
For medical school, I remember. the very first month I started, it was incredibly overwhelming. And it's just like so much information that you have to learn. And I didn't do any kind of physical activity. I literally like went to class, came home, studied, went to bed. And I did that for an entire month. And I was absolutely miserable. And I was like, I can't live like this. Like this isn't gonna work out for me. And so I kind of had to like step back and realize that I needed to take time for myself. And it's hard when you have so much that you need to learn and an unreasonable amount of information to get through within like a month block or even within the day that you have to study. And so um, I at first felt pretty guilty, like going for a run or like going to the gym or doing something to take care of myself. And it kind of sucks when you're like trying to do something that you love and you have this like in the back of your head, like you should be studying right now. Like, what are you doing? You're wasting your time, kind of thing. But I found that by making time for myself, I was able to really reset my mind and come in way more fresh to my studying. And so, even if I did take an hour and a half to go do something that I enjoyed, coming back, my studying was much better than if I would have, sat through. Because there's really only so much your mind can take. I know people will sit and study for like hours and hours on end, but um, taking breaks is normal, and I think it's healthy. And yeah, so that's kind of how I really balance my, I guess, like work and life in medical school. I really like half marathons. That's kind of my favorite race, and so always just kind of like training for the next thing and keeping track of the runs that I was doing and creating workouts for myself. It was really good. Like I think it was just helping me to kind of have my mind focused on something other than school. And getting back into running now, last year was a pretty crazy year. And finding that life balance was a little more challenging than in medical school. Was working like 80-hour weeks and times where I was working 12 days in a row and having 2 days off. And it was just pretty exhausting. And so it was a little bit harder to keep a routine, I guess. But I am into like weightlifting and bodybuilding. And so was in the gym whenever I could last year. And honestly, Miami's like way too hot to run. And so it's just like so humid outside. Yeah. And so being in San Diego, I like have more time and like have a routine. And it's kind of nice just being able to breathe and kind of incorporate that work life balance again. So in the gym a lot more frequently, getting back into running. It takes a second, I feel like, to just like get back into the groove.
That I mean, I'm still trying to find a good like life school balance. We've talked about it like a little bit with some of our other guests, but I feel like it's really difficult because I'm always like I'm very like forward thinking. I'm like thinking of the next thing I want to do and like obviously like medical school and like residencies and stuff. Like even though it's far, like I think about it all the time and I'm like everything I do is going to impact it even though like it probably won't. So I'm trying to find that. So every time I hear somebody like a physician or a resident or a medical student saying like, "Oh, I still have time to do this. I still have time to do this." It gives me like a little bit of breathing room. I'm like, "Okay, I can do it too. Like it's fine."
Oh yeah, no, you can definitely do it. It takes like some mental discipline to not let yourself get sucked into like you're studying into school. And medicine in general just kind of brings in the anxious person who wants to do their absolute best always, and we're the people pleasers, wanting to make sure everyone feels okay. And so kind of having to, and like I think that's something that I really had to learn in medical school and like an intern year especially is kind of reframing my mindset to where I obviously love like taking care of people, but I am learning how to prioritize myself and not let myself get as anxious and um, just like trying to live in the moment. Because there is like, I like can't wait until I'm an attending and am doing work and, done with my training and everything. But you just got to take it one day at a time.
What are your favorite things to do in San Diego?
Yeah, I really love going to the beach. So my husband and I try to get to the beach at least once a week. There's a lot of really good trails out here to hike, and so we've been doing some of those. Um, The food scene is pretty great, and we live in the downtown area, which is pretty walkable. And so we're kind of by the water, and it's nice just kind of getting to hang out. And I've been getting to know like my classmates or my co-residents, and so it's been fun just kind of connecting. We want to explore more of California just because we haven't had a we've just like we visited LA like a few years ago when I was doing an away rotation out here. But outside of like LA and San Diego, we haven't done a ton of exploring. So we're excited to just kind of check out like national parks. Eventually end up in like Northern California to see like San Fran and that kind of thing. So
I am not an LA person. I'll just put that out there. I That's where I lived for like 9 years and I'm like
yeah, it's definitely different. It's a different like lifestyle and pace than San Diego. It is pretty similar to Miami, though. I feel like that just energy, and so I got used to like living in that kind of energy. So San Diego feels a little bit slow, but it's a good kind of slow. It's like the kind of chill that we kind of needed. So
you said that you didn't want to be a radiologist at first because your dad. So in medical school, did you kind of have a different idea? Were you like leaning towards one way?
coming into medical school, I wanted to do emergency medicine. I had some shadowing experience in undergrad and really liked it. I liked the pace and getting to see a bunch of patients. And it's kind of quick. It's kind of like an in and out thing. Like you have to make a decision pretty quick on your feet. Like, is the patient going to be admitted to the hospital or is the patient good enough to go home? And so emergency medicine was definitely something I initially wanted to do. I also really liked cardiology. Um, I thought that it was a pretty fascinating field, and I had some exposure in the angio suite or the cath lab with interventional cardiology, and I was just blown away by the procedures they were able to do um, for patients with heart attacks and everything else kind of with the heart. And I remember being super impressed with the fact that it was minimally invasive. So instead of having to do an open heart surgery, they're able to treat heart attacks just by pricking either your wrist or your groin to get access to the artery and open up those vessels to the heart. And um, in my second year of medical school, it was while we were learning about the GI tract and everything that has to do with GI. I learned about the TIPS procedure, which is an interventional radiology procedure. It's done to kind of offload pressure that's in the liver that can develop in cirrhotic patients. And it basically connects the two different venous systems together. And I wish I could just show you a picture because I feel like it's probably easier to like show than to explain. But it's a wild procedure that they're able to do. They basically stick from the IVC, which is the main vein that runs in the body, into the hepatic veins that are in the liver. And so it creates a completely new like shunt or connection that offloads that pressure from the liver and helps with preventing GI bleeds in those patients. And so I was just blown away by that procedure. I was like, this is really cool. And my dad being a radiologist, he had never told me about interventional radiology, and so I remember asking, like, "Hey, like, I had no idea you guys could do this kind of stuff, or that there was a subspecialty that focuses on procedures." And he was like, "Yeah, I just didn't think you'd ever be interested." And I was like, "No, this is like the coolest thing ever." And so um, I was just so moved by it and decided that I wanted to get more involved. And so I shadowed a interventional radiologist in Savannah where I was doing medical school, and my first exposure was actually in their clinic. And so, when you think about radiology, you don't think about them having clinics, right? You think of them being in the basement of the hospital in a dark room, just looking at imaging. But yeah, but he has a clinic that he was seeing patients that he was following kind of long term. He in interventional radiology, a few of them will also do the neuro procedures. There is a more specific neuro interventional radiology where you like specifically do procedures in the brain, but he kind of has like a hybrid mix, and so I was just blown away by going into clinic and the patient, like thanking him for removing the clot in his brain that was causing his stroke, and he's like up and walking and able to live life. And so I was just really touched by that. And that patient interaction, because I love working with people. I'm definitely more on the introverted side, and so um, I don't know if I could do something that's super patient facing, like family medicine, but the idea of like having procedures during the day, getting to do clinic and seeing patients kind of post op or before you kind of plan procedures was really appealing to me. And so um, I was really sold though when I got to scrub into some cases and got to see him at work, and I just knew that it was for me, and haven't turned back since.
Yeah, it's like when you see stuff like that, like gets your attention, I guess, and like captures you. Oh, it's just like amazing. Like I also got to shadow a trauma surgeon and a neurosurgeon and I guess a heart surgeon, and I saw all that kind of stuff. So it was super cool, but I want to be a neurosurgeon, so that was really kind of how you're talking about is how I was like feeling. Um but in that procedure, I'm pretty sure there was an interventional radiologist. Like there was the neurosurgeon doing the spine, and then they had like scans going on during it. Is that interventional radiology?
Yeah, so there are a few specialties that will use imaging during procedures, and neurosurgery is one. Orthopedic surgeons also will use fluoroscopy or imaging while they're doing their procedures, like in the different joints or in the spine. And so, using imaging for procedures isn't solely an interventional radiology thing. That specialty came up with essentially all of those procedures, and different specialties have kind of adopted them. But yeah, like interventional radiologists can do spine work as well. So um, I guess kind of the main ones that an IR interventional radiologist can do are like vertebroplasty or kyphoplasty, where essentially put cement into compressed vertebral body fractures so that you can help reduce that pain by just giving that vertebral body height again, so it's not pinching those nerves.
Everything about like the procedures and stuff, it's so cool to me. Is that like your favorite part, getting to like do the procedures and stuff?
Yeah, it for sure is. Being this early in my training, I haven't really done, much on my own. It's always kind of assisting or getting to do a few little things here or there. But I know that when I am practicing, that I'm just going to find it super rewarding. One thing that I really like about IR too is that you really have to think on your feet. Everyone's anatomy is different. Even something that should be a simple procedure can get complicated, and so you just have to be ready to know which catheter am I going to grab, what wire should I use. There's a lot of planning that goes on before, but there's also a lot of kind of picking and choosing during the procedures as well. And so I like having to just kind of like be thinking the whole time, and it's not something that's just like a copy paste. It's really unique to each patient, which I think most procedures are, like surgeries or that kind of way too. But I really like the innovation in IR. They're overall, like as a specialty, it's people who are really excited to kind of try a new thing or try the next thing or try to solve different um, different problems that patients have. So one thing that is becoming more common, which I am really interested in, there's a few things I'm interested in, but this is one of them, is pelvic congestion syndrome. And so this is when women will have abdominal pain. So like cramping, it can be related to having intercourse or to periods, but it's basically a venous backup from the ovarian vein. So they're having basically just congestion of those veins. Like um, I'm sure you guys have seen like people with varicose veins in their legs and how those veins are like big and tortuous. It happens in the ovarian vein, and so IR can go in and basically block off that flow so that there isn't that backflow and relieve that patient's pain. And so it's cool that there's like new procedures for things where we actually had a lecture earlier today about pelvic congestion syndrome and how Some providers, it's not common now, but people used to think that pelvic pain in women was more associated to a psychiatric thing than a physical thing, and we're now able to show like no, like there is physical reasons why they're having pain, and we're able to have solutions for that. So
That's really incredible. I'm personally interested kind of in the OBGYN area. And so hearing that is actually really cool because, of course, I think and if I decide eventually to go into that, that there's going to be options such as, and ideas around things that are beyond, psychiatric or solely menstrual and other issues with that. So I think that's really cool. And I have to admit, I radiology has not been something I've done a lot of research in, and I think it's really cool that, especially with the radiology that you get to practice and look into, that you're really at the forefront of a lot of problems that people don't realize. It's almost like I think it's called like the hidden warrior, the silent hero, something like that, where there's like you're in the background but still creating so much of the solutions that we see today.
yeah, no, it is cool. It's cool getting like I think the a common like nickname for a radiologist is kind of being the doctor's doctor, and so what you see on imaging really helps determine what the next steps are going to be for patients, and it kind of opens up the floor for like different treatment options as well for patients, and it's it's fun getting to kind of collaborate with different providers, and there are a lot of different kind of board meetings that will happen too, like in the hospital, for example. Tumor boards are something that are, I think, probably across the board, the majority of hospitals will do, where they'll have a surgical oncologist, a medical oncologist, a radiologist, and whoever else is kind of involved in whatever type of tumor that they're discussing. And the radiologist will present the imaging, and it's usually like the more complicated cases, kind of trying to decide like, okay, do we do X, Y, or Z? And by having that conference and all of them collaborating together, they can figure out what the best options are for patients. And so it's really cool getting to see great minds like that just kind of come together and find solutions for people.
I have a question about, I guess, the like well-being of a radiologist, because you are exposed. Well, I don't know if it would be more the tech that's exposed to radiation, but is there any risk that comes with being a radiologist and being in that environment?
Yeah, so it depends on whether you do procedures or not, essentially. And so with interventional radiology, yeah, there is a risk because you're using radiation to do your procedures. Um, we we like learn a lot about radiation safety. We wear little badges that will track how much radiation that we're getting, so we know what our exposure is while we're doing procedures. We can see real time how much radiation is within a procedure, and so it's something that we're mindful for the patient, but also for the staff as well. um, when you're doing fluoroscopy or using any kind of radiation for procedures, you will wear lead. And so we have these aprons that we wear, and they're actually a new thing that's kind of developing is an association with radiation and the development of glaucoma. And so now you can get glasses that are lead lined, so it helps to protect your eyes. Um, and so, yeah, there's different things that are done to kind of help protect the staff that are involved. It can't be 100% like clear of the radiation, unfortunately. I know that I have to look into it because it's actually been a few years, and I'm sure that it's kind of evolved a little bit. But there's actually different kind of um, tools, I guess, that are maybe coming out. You know how surgeons can do things robotically where they're not, physically over the patient. They're kind of like in the back corner and getting to do things through the robot. There's talk about maybe doing something similar to that when it comes to interventional procedures to kind of reduce that radiation risk. And also using we use ultrasound too within vessels, but I think that they are trying to figure out how to like 3D map essentially. And so even just trying to find ways to do procedures like without radiation is something that's kind of, you know, talked about. I don't know how quickly any of those will develop, but I know that that is kind of out there. And as far as wearing lead and stuff, we also have different coverings that we can, there's like plastic shields that we can put kind of over ourselves, or, you know, there's different things that you can do to try to reduce your dose, but you just have to be mindful. And yeah.
I'm laughing because when I was shadowing the trauma surgeon and I was in these surgeries, I had to wear lead, and I was sending Sienna like pictures of myself like covered in like the plastic and the lead. It was so funny. But yeah, that's my little comment.
My mom actually a few years ago she actually had some cancerous lymph nodes and cancer in her thyroid, and so I remember she had to go through the whole radiation process. And I remember she was put on, and you can speak more on this, she was put on a really strict diet for about a week in order to flush out the radiation, and then also, replacing bed sheets, keeping distance from people. Um, would you mind going a little bit into that and just kind of explaining maybe a little bit of the science behind, you know, post radiation and things like that?
Yeah, I definitely can. And I can speak about this because I just had my nuclear medicine rotation. If I didn't have it, I don't know if I could speak super confidently about it. But essentially, the treatment that your mom had was a radiation therapy. And so, what's different from what she had versus with imaging? So, the radiation and imaging is kind of outside in, but the radiation that she had was inside out. And so she wasn't able to eat food with iodine because the thyroid takes up iodine and the radioisotope that's used to make sure that all of the radiation goes to the thyroid is basically attached to like iodine. And so the idea is that you get rid of all of the iodine or have like a very low iodine diet so that when you take that radio tracer, it goes straight to the thyroid and can do its job killing the cancer cells there in the lymph nodes as well. So pretty much anywhere that has those tumor cells, it goes directly to. And then the reason why she had to kind of wipe everything down, change sheets, she probably had to throw away her trash separately from you guys initially as well, is because that type of radioisotope is excreted in saliva and urine and just bodily fluids essentially. And so it is usually about a week or two where you kind of have to be just careful because your body is getting rid of all of the extra radiation basically that wasn't taken up by the thyroid. And so that's kind of why she had to do that like regimen and everything. And the reason why you can't really like stay around family during that period is just because you want to reduce that risk to like family and stuff. So
That actually makes so much sense because I remember this was maybe 10 years ago now, so my memory's a little faded from it, but I remember we had so much of the Morton Salt because, and now thinking about it, it's iodine free, and that makes so much sense. I was like, why did we switch the salt? Like it tastes weird, and that makes a lot more sense. So that's really interesting because I do remember it was very specifically, very like low salt things, a lot of kind of vegetables, like cruciferous things, and so that's really cool to kind of learn about the reasons why. And I remember it was a pill, so again, like inside out. So really, really interesting.
Sienna, I hope that your mom is doing well after the treatment and stuff.
Yeah, she's been cancer free for a number of years now, so it's been good. She of course still goes back for yearly checkups, but I think it's been 8, 9 years now that she's been cancer free. So the radiation worked really well. She had surgery. I believe she takes Synthroid now because the thyroid was removed, but she's been really healthy since, and it's I think like she never had to do chemotherapy or anything. And again, I think that all is credited to the radiation. And yes, there are risks, but I think overall it's such a great tool for people to be able to use. That's not, I would say, well, for me personally, of course, that's to each their own, but so much less invasive than tons of different surgeries or chemotherapy or frequent inpatient hospitalization. And so I think overall it was a really great thing that she was able to have access to.
I think like radiology is like it's like my second choice favorite specialty. And I feel like if I were to do radiology, it would definitely be in the brain because I'm not gonna lie, I was reading those scans with the radiologist and I didn't know where the kidney was for the first like 2 weeks that I was there. I was like, what's that? I'm like, and he's like, the kidney. And I'm like, oh, okay, every single time. But now I know where the kidney is and I'm just a little nervous of the radiation. That's it.
So if you aren't doing procedures and you're just reading, you're not exposed to radiation. So there's definitely ways to basically essentially have like zero exposure and be a radiologist. So if you do like the imaging aspect of it and not so much the procedural part, you can definitely have like a reduced exposure.
Very excited for where you end up going with your career. But I guess speaking on that, actually, is your residency 5 years? Because that sounds a lot longer than a lot of other, professions in the medical field. A lot of them I think can be maybe starting at 2 years. So five sounds like quite a time.
Yeah, so it'll be 6 years total by the time that I'm done. Because I had that intern year that counts as like my first year of residency essentially, and then I've got 5 more years in that second year right now. Yeah, it is a long time. There are a few specialties where it is pretty long, like neurosurgery is one. Essentially, all of the surgical specialties are pretty long. I want to say, and don't quote me on this because I don't know for sure, but I think general surgery is about 4 years. OB-GYN is about four. If you do internal medicine or family medicine, those are three. And then emergency medicine is 3 to 4, depending on what program you go to. But if you do want to subspecialize within internal medicine or within OB-GYN, it does add, time. So if you wanted to do interventional cardiology, you do 3 years of internal medicine. I think it's, and don't quote me on this either. I think it's like 2 years of 2 or 1 years of cardiology and then an additional year of interventional cardiology. And so it ends up being about just as long as what I kind of signed up for. So
Do you plan on like doing a fellowship or anything to, I guess, like further specialize in interventional radiology?
the track that I'm on, it's basically tying in that fellowship year into that 6 years of residency that I have. And so by the end of 5 years, I will have, well, I'll be board certified in diagnostic and interventional radiology. And so I'll be able to practice both. But I plan to focus more on the interventional side. It kind of depends on where you practice too. So if you work at a smaller community hospital, you may have kind of a split. So there may be days where you're doing procedures and other days where you're reading. And so I think it's good to have that double board certified so that you can read if you need to, and then you can do procedures kind of as needed. But I have right now a really big interest in interventional oncology, and so I am hoping that I'll have kind of my own clinic where I'm doing procedures, seeing patients, and doing that like 100%. But I also really like all the other procedures too, so we'll kind of see what ends up happening by the end of all of this.
I guess going more into kind of your future goals, like with interventional oncology and everything, and I'm assuming you said with having kind of your own practice, what I guess as well kind of do you see or goals that you have for your future, maybe other things like where you might want to live or some primary specialties that you would like to pursue?
So right now, I'm interested in interventional oncology. That may switch up, but I guess kind of the dream that I have right now is that I would have an outpatient center essentially where I can do procedures and do clinic, and so it wouldn't be part of like a hospital per se. It would be kind of like its own little place. So surgeons will have facilities like this. Like I know vascular surgeons will. I think some orthopedic surgeons probably do. A lot of plastic surgeons kind of have their own practice, and so it's in a similar kind of setup where they have like their OR rooms and then they have their like clinic rooms. I would have like an angio suite and I would have clinic rooms, and so um, we'll see like how I'm able to kind of put that all together, but that would be kind of the dream. And so the idea would be that I'd have patients, like cancer patients, referred to me. I'd be able to talk to them about different treatment options, be able to do the procedure, and then kind of follow up on just follow them along their course.
That's actually really cool because I feel like we kind of relate on this topic a little bit. Of course, I have a much longer way to go, but my kind of big picture goal at the end of everything is to one day own my own gynecology practice. Like that's the idea, the big picture that I have right now, and hopefully like yeah, one day being able to have people referred to me or being able to just have my own practice and my own and like my own employees and kind of work for myself in a way I think is something that I really value and also hopefully one day want to pursue. I've been taking a few marketing classes and business classes at my school, and so I was thinking maybe doing like a minor in some area of business, except I cannot wrap my head around economics, so I don't know, but I do like the other parts of business, so we'll see how everything goes.
Yeah, for sure. I think that's a great idea. I have like zero background in business, and so kind of when that time comes, it's going to be something that I will kind of have to figure out on my own and get just kind of advice from mentors. Yeah, I think having a background would definitely be helpful. Like in any aspect of medicine, even if you are working as a hospitalist or working in a hospital, it's good to have an idea of like just how to run a business basically because it is work at the end of the day.
Mm-hmm. Yeah. And I mean, obviously neurosurgery is different, but when I was shadowing the trauma surgeon, she was kind of explaining to me like the private practice and like the hospital, like working environment. And she was like, you normally would have like your own private practice and work in the hospital. So I'm like, are you sure about that? And she's like, yeah, like that's how it works. And I was like, really? Like I didn't obviously say that to her, but I was just like, both? Like what? So I'm like, maybe I'll do that. I don't know, but
Yeah, that's definitely something that you could you can do in balance. Yeah, for sure. Because I know trauma surgeons will definitely have clinic and they see their patients and have that kind of private practice like area while they're like so a lot of them are or not this is I guess like a generalization but a lot of different medical groups will sometimes like be like their own private practice essentially and they have contracts with the hospital and work for the hospital and so that's definitely a way of working in a hospital but also kind of having your own practice and then some people are employed directly by the hospital so there's I won't go into all of that. And I'll be honest, I don't know like all the details of all of that, but there are a lot of different avenues of practicing medicine.
Before we fully end, we do have a thing that we like to do at the end of our episodes, and it's 3 questions, and they're a little bit of a rapid fire, and you can choose how long or short you would like to answer these, or if you would want to further elaborate, you are more than welcome to as well. And so, yeah, we will start off with the first question, which is what is one piece of advice you would give your high school self?
That's a great question. I guess just don't give up on the dream. Like it's all worth it. It's a lot of work, and as you kind of go through it and look ahead, it's like it's scary, right? And looking back, I'm just like, how did I do all of that? But you really kind of have to take it day by day, and you just have to be committed to it. Doing the little things to make sure that you're taking care of yourself and that you are taking steps towards your goal, I think is important. And so I think I would tell myself to just dream big and kind of go for it because it is worth it in the end.
I always hear the kind of quote like trust the process, and again, I try to embody that for the most part. Even now, half the time I'm like can I even do this anymore? And then I have to think, I'm like, one day, if I sit here and sulk about this, I'm never gonna have the goals that I want in the future. Like I have to just stay true to what I want, be authentic, and keep pursuing and working hard. So yeah, again, I really think that's great, and I haven't really heard that one yet on our show. So I really am happy that you shared that with us.
It's important to us because obviously we're good friends, and it's important to us to have like good relationships and friendships. So how do relationships play a role in your life, like regarding like friendships? I guess like you have your husband, you said, your family, all that kind of stuff. Like how does that play a role in keeping you grounded from your busy schedule, and I guess just in your life?
Yeah, it's definitely super important to stay connected with friends and family. It's hard, and like there's going to be events that you have to miss, unfortunately, when it comes to family. But I think as long as you're trying to prioritize them when you can, I think that's really important. And so getting to spend time with my husband is like the best part of my day. And so he's been like my biggest support through it all, and really kind of helped me see this dream and see the potential that I have. I, he's been a really big part of my growth. I think just kind of becoming the person that I am, and his love has been absolutely wonderful. But as far as like family and stuff, like yeah, just trying to do whatever you can to be connected with family and friends, and even when you're tired, like it's always worth it to make time and try to see them and stuff. And it really does suck when you kind of have to miss things that you wouldn't want to miss otherwise, but I think that's also just kind of part of life, and part of the grind of medicine. And so yeah, I think just like having a good support is definitely helpful. My husband, we met when I was in undergrad, and I think I was starting OChem the semester that we met, and he was like with me, after those exams, and I'd be crying like I failed, like this is like so terrible, and then um, somehow made it into med school, and then was with me through medical school and doing it through COVID, and was kind of really just my big support on even applying to the West Coast schools out here. Because I was like, I don't know, like I came from a small school in Georgia. There's no way I'm going to end up at a UC school. And he says, like, no, like you gotta do it. Like there's nothing to lose. And yeah, family and friends is it's important.
Does your husband also have a career in the medical field, or did he pursue something different?
No, yeah. So he is in tech. So he works in the whole like tech world. He's actually launching his own business right now, and so he's got his hands full with that. But yeah, so it's fun. It's fun having somebody to do life with, and I personally really love having somebody that's outside of medicine. So, um, I'll talk about work and things I've seen, and just the stresses of like med school, and just like what you see at work and stuff. But it's nice being able to kind of turn that part off and get to hear about what he's doing and the projects that he does. And um, yeah, I like having somebody that's not in medicine, just to kind of create that balance in a space where my head doesn't have to be in medicine 24/7. But I know some people really do like having a significant other that is in medicine. So there's, I think, pros and cons to both probably. But
Well, congratulations to him, first of all. That is incredible. And I wish him all the best with his tech company. Our final question for you is, what is one thing you are currently struggling with, and what are you doing to overcome it?
I guess the one thing that I'm kind of struggling with right now is being a first year radiology resident. So I like don't know anything is what it feels like. It almost feels like starting medical school over again, because radiology is like pretty different from other aspects of medicine, and I don't think that there is, at least, uh, again, a generalization, but I don't think you get taught radiology very well in medical school. And so, just being on the different rotations and having to learn so much is definitely overwhelming, and it's kind of a struggle. I think that I finally figured out my balance, and like what resources that I want to use, but it's still just a really steep learning curve, and just trying to figure out the best ways of like managing that. And so I feel like I came out of intern year pretty confident. Like I felt like I knew what I was doing. Like I felt like, I'm a doctor, I got this. And then I started here and I'm like, what am I doing? I have no idea what I'm doing. And so it's just imposter syndrome, kind of seeping in, and starting from what feels like ground one it's a lot. And so just trying to make sure that I find like my confidence and just keep myself grounded and know that I am very early in my training, and by this time next year, I'm going to have all the different rotations under my belt and know a little bit more about what I'm doing than I do now. But I think, yeah, just trying to make sure that I stay grounded is kind of the best way that I've dealt with like the struggles of being a first year resident.
I don't know. I know there's a lot to radiology, but you sound pretty well versed in the subject, I would say. You've definitely helped us understand it a lot because I was confused at first, but you're going to be fine.
Thanks, I appreciate it. I think it's really awesome what you guys are doing, having this podcast, and I just like I really admire like the fire that you guys have like in your hearts to kind of step out and do something like this. I know that my high school self would have been like way too nervous or anxious, or just not confident. But it's really cool that you guys are like taking this step and doing something that you guys love and are passionate about. So kudos to you guys.
Yeah, we really appreciate that. It's actually really funny. Before we got on with you, we were chatting and we were like, I'm so happy we did this. Because it was definitely something we were going back and forth about for a while on wanting to do some sort of project. And Maddie even said after, now she's like, we just have to keep doing this. It's so fun. And it really is. And I love to get to kind of learn about all these different avenues of medicine that I had never even heard of before or didn't really know enough about. And I really feel like I've grown so much, even within, we've been doing this for about a month now. And even so, within a month, we've been able to have the opportunity to speak with so many people. And you're our first radiologist. And so, even so, today, we've been able to learn so much about you and your career and the process in general. And so we're really grateful for people like you as well, who are willing to come on and kind of tell us about your experience, because we really do get so much out of it personally and overall as a podcast. We're really excited and passionate about this.
Yeah, thank you guys for having me on.
No, thank you.
We had a great time talking to you. And yeah.
I'll see ya.